what are your thoughts about alcohol and breast cancer risk?
Well, I think like with anything, as far as risk is concerned, like they always ask, well, how can I reduce my risk of breast cancer? Right? So you're going to hear from any doctor for any cancer, right? Lifestyle, obesity. They say with obesity, there's an increased risk. You want to eat well, you want to exercise, all of these things. But then yet I can tell you about my very good friend who was at the age of 40. She was a runner, right? She drank, green juice or whatever it is she was doing. She had cancer, right? So it doesn't, just because you do all these things doesn't necessarily protect you. Alcohol, from what I've heard, and actually I was listening to one of your podcasts, I think from Med Evidence, and I did hear you guys talk about alcohol, but everything in moderation is the way I feel. I feel to say to someone, don't drink alcohol at all. Mm-hmm. I don't think that makes any sense. Just like, don't drink coffee, right? Mm-hmm. If a patient comes into me, she's got multiple cysts. We know caffeine can affect the breast and they could end up developing more cysts. But are you going to tell someone, well, you got to stop caffeine, completely? Very hard to do. I think if someone's drinking alcohol on a daily basis, that's too much. And I do think that is of concern. So yeah, no, I would say
all good things in moderation is the lesson.
I personally think, all good things in moderation.
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.